Guys, welcome again to another video. You're here with Shalane, and today I want to look at two words that sometimes there's a misconception. So here we go. If you work in sterile processing, there are two words that you absolutely need to understand: bioburden and biofilm. They are often used as if they mean the same thing, but they don't. Both can involve microorganism and contamination, but bioburden is the contamination presented on an item, while biofilm is an organized committee of microorganism that attach to a surface and develop a protective structure. That difference matters when you're cleaning surgical instrument. So here's a way how to remember the difference. So bioburden is what contaminating the instrument, and biofilm is the microorganism that has attached and built a protection around themselves. Common misconception about bioburden and biofilm is that bioburden and biofilm are the same thing. Absolutely false. An instrument can be bioburden without having an established biofilm. Biofilm requires microorganisms to attach to a surface and develop an organized protective matrix. As it relates to sterile processing, bioburden can be associated with contamination such as blood, tissue, body fluid, microorganism, and other organic material. Instrument used during surgery has fresh blood and tissue contamination. Our primary purpose as a sterile processing technician is to remove the bioburden and soil through the appropriate cleaning. Instruments that are used after surgery, it is very important that instruments are clean right after, because those instruments contaminated may carry a significant microbial load. This is why proper point of use treatment, transportation, cleaning, rinsing, and inspection are so important. The longer the contamination is allowed to dry, the more difficult cleaning becomes. Biofilm, however, is a community of microorganisms that attach to the surface and become surrounded by a protective extracellular matrix. Think of it almost like microorganisms building themselves a protective home. Biofilm can develop on medical devices and instruments, practically make it difficult to clean areas where moisture and contamination remain. So, in other words, biofilms are mostly in areas that are hard to clean. So you'll find them in lumens, inches, box locks, cervix, channels, any type of areas that is very hard to clean. So biofilm, once it mature, biofilm develop, removing it can be much more difficult than removing ordinary contamination. Simple way of explaining the process is that contamination, microorganism attached, biofilm develops, protective matrix form, biofilm matures. This is the reason why we don't contaminate surgical instruments sitting around and drying for a long period before cleaning. Proper point of use treatment and timely cleaning helps prevent conditions that can contribute to the biofilm development. Biofilm is normally developed on instruments that has difficult internal areas to clean, because over the time, instruments develop a protective matrix. So it makes it more difficult to remove. That is why what happens before the instrument even reaches the sterilizer, it is very important that it is properly clean and follow the manufacturer IFUs. Understanding the difference between bioburden and biofilm helps explain why every stage of instrument reprocessing matter. From point to use treatment matters, transportation, cleaning material, water quality, detergent concentration, temperature matters, contact time matters, mechanical action, inspection, and following the IFU, manufacturer's IFU matters. The sterilizer is not shortcut round for poor cleaning. This is the reason why it's very important that every sterile processing technician knows this information so that we can do proper safety for patient care. Here's what I want you to remember. Bioburden is a microbial contamination presented in an item, while biofilm is an organized community of microorganisms attached to a surface and protect within a matrix. They're related, but they're not interchangeable terms. And in sterile processing, understanding that difference isn't just passing a certification exam. It's all about protecting patients, because before an instrument can be safely sterilized, it first has to be properly cleaned. Closing question is that STB profession, have you ever heard someone use bioburden and biofilm as if they're the same thing? Drop your answer in the comment below and follow for more sterile processing education.